Hi, I'm Karen with Empowering True Health, and it is Tuesday, it is the 21st, 2023. And I want to share with you part one of a series I've been doing in my newsletter that is called Would You Rather? And I'm looking at two options that can address an aspect of health that a lot of us might either have experienced or know someone who has experienced. My goal of all of this is really to improve health for the long term. And the information that I'm going to share with you comes from books, journals, research articles, things that really anyone can find, including manufacturers' websites. And so I am just sharing that information so that you can make an informed decision regarding your health. So I want to start by looking at heart disease. And my focus for this is going to be on cholesterol. And higher levels are connected to heart disease, and that increases your risk then of heart attacks. There was a study that was completed in 1961 called the Framingham study, which showed a connection to cholesterol and heart disease. I imagine you probably are aware that we have two types of cholesterol in our bodies. The HDL is what we consider the good cholesterol, and it works to get rid of the bad cholesterol, which is the LDL, that is in our bodies. The LDL is the one then that contributes to the plaque buildup in our arteries, which can ultimately lead to heart attacks. So the more LDL we have in our bodies, the more HDL we are actually going to need. Now, if you don't have that much LDL in your bodies, then you really don't need that much HDL. Those levels are going to be lower. So if you get diagnosed with high cholesterol, often the standard treatment is statin medications. And what they do is decrease your LDL levels, which, as we've just seen, is a symptom of high cholesterol, so that your risk of cardiovascular events, such as a heart attack, goes down. Couple statins that can be used are Crestor and Lipitor. And if you look at their information, you find out that they decrease cardiovascular events by either 1.2 or 1.6%. And so then a study was done looking at the medications to reduce cholesterol. And again, I'm not going into what they are and the references in this. I do have all these references in my actual article that you can get through the newsletter. And they found that in this study, the medications that were used did reduce cholesterol to below 150 milligrams, which is kind of that target. However, they went on to find that 1 in 4 people in the study had a new cardiovascular event or passed away within 2.5 years of that study. That's 25%. So the researchers had stated that the participants did not change their diet, so they just were taking the medicines. They continued eating the standard American diet, which, even though they were taking medicines, kept building up the plaque in their arteries. In addition, some of the medications can cause side effects. 50% of people that have been prescribed them often discontinue them because of the side effects. And there's some common ones, headache, nausea, dizziness, muscle aches. We hear about those a lot. Also increases risks of musculoskeletal injuries, dislocations, sprains and strains. Can't say that today, I guess. And it doesn't matter how long you've been taking them. It can be a short period of time or a long period of time. They're finding that these things happen. There is also what they're calling an unexpected side effect of statins. And that some researchers have found that when people take them, they actually increase their fat and calorie intake, which then we know increases weight and BMI. And the thought is that patients are not incentivized to change their diet and lifestyle because they're thinking just that medication is going to negate any harm that what they're doing to their bodies by eating some of the standard American diet. And we saw from that study that I mentioned a minute ago that, that's not really the case. So the statins is said in a on a website that they're not a cure for high cholesterol, but you should keep exercising and eating healthy even if you are taking them. Now, we obtain cholesterol from the animal foods that we eat. Do you know that our bodies make cholesterol as well? So we really don't need to eat very much of it. If we look at something called the China study, which was done probably at least 30 years ago, it has discovered, and it's still true, that heart disease is geographically distributed based upon people's eating patterns. So it's not seen in populations where they consume a whole food plant-based eating pattern or a lot of animal foods in general. Some of the populations that they found without heart disease have a total cholesterol below 150, which, as I had mentioned before, is really the ideal and is healthy. I've also talked and written about the work of Caldwell Esselstyn. He has used a strict whole food plant-based eating pattern to treat heart disease. Another person who's had a lot of luck with this, not only with food but lifestyle changes, is Dr. Dean Ornish. Look into the lifestyle heart trial that he did. He had a lot of success reversing heart disease. And so at the end, a whole food plant-based eating pattern does have side effects, but these include losing weight, lowering cholesterol, and cleaning out your arteries. And so if this eating pattern, now if it's not processed vegan food, addresses the cause of heart disease with no negative side effects. And as T. Colin Campbell says, and I may have even used this before, the same foods that get us out of disease help prevent disease. So this is just a little bit about two sides of the story when it comes to heart disease and cholesterol. Knowing those risks and benefits, of any treatment, including diet, should be a part of the information that you are using to make an informed decision about your health. So in the end, I guess my would you rather question for this video is, would you rather take statins or eat a whole food plant-based eating pattern? If you enjoyed this, please give it a whole food plant-based eating pattern. If you enjoyed this, please give it a thumbs up. Share with somebody that you know who might be able to use this information. And if you haven't, please subscribe to the channel and let's get this health revolution going. So until the next video you watch, be healthy.